Hello everyone, welcome back to my channel Dr. Sushant's anatomy tutorial. In this very small video, I am going to talk about the ossification of humerus. Ossification of humerus. Now the humerus is a long bone and it ossifies in cartilage. So the humerus basically ossifies from one primary center, that is for the shaft, one primary center for the shaft, and there are three secondary centers for the upper end, three secondary ossification centers for the upper end, and it has four secondary ossification centers for the lower end. Okay, so this primary ossification center for the shaft, it appears in the middle of the shaft, at the middle of the shaft, and it appears during the 8th week of intrauterine life. So here is the somewhat middle, we have the primary ossification center, and this primary ossification center appears during 8th week of intrauterine life. Now coming to the secondary ossification centers for the upper end. So the secondary ossification center for the head appears during the first year. Okay, here that is for the head. So head appears during first year. Then for the greater tubercle, it appears in the third year. So greater tubercle, third year. Then for the lesser tubercle, during the 5th year. So lesser tubercle, 5th year. Right? And all the three centers unite in the 6th year. These three unite in the 6th year, and then they form something called a compound epiphysis. So how is this compound epiphysis formed? By the fusion of the secondary ossification centers for the upper end. They fuse with each other and form compound epiphysis, and that's during the 6th year. Okay, and then they fuse with the shaft. They fuse with the shaft around 20th year, as per the ossification of the upper end. And for the lower end, the ossification centers for the lower end, there are four ossification centers for the lower end. So the secondary ossification center for the medial epicondyle appears during 5th year. Okay, about 5th year. Then for the medial flange of the trochlea in the 10th year, this one here is the 10th year. Please remember, secondary ossification centers appear after birth. So for the medial flange of the trochlea in the 10th year, and for the lateral flange and the capitulum, during the 2nd year. Okay, this is during the 2nd year, that is lateral flange of the trochlea including the capitulum during the 2nd year. And for the lateral epicondyle in the 12th year. This 12th year. Now what happens? The medial epicondyle fuses with the shaft by a separate epiphyseal line. So medial epicondyle, this fuses with the shaft by a separate epiphyseal line, and this happens between 16th to 17th year. The remaining three secondary ossification centers, they fuse with each other and they form a compound epiphysis, and this compound epiphysis is formed when during 18th year. Okay, 18th year, and then they fuse with the shaft during 18th year basically. So the remaining secondary ossification center join with each other, forming a compound epiphysis, and then they fuse with the shaft during 18th year. So this is a very simple concept. So ossification of the humerus takes place by one primary center and three secondary ossification centers for the upper end, four secondary ossification centers for the lower end. So the primary ossification center appears in the shaft during 8th week of intrauterine life. In the upper end, it's easy to remember, during first year for the head, third year for the greater tubercle, fifth year for the lesser tubercle, and they fuse with each other during 6th year, and then with the shaft during 20th year. So you have to remember these numbers: 1, 3, 5, 6, and they fuse with the shaft during 20th year. Similarly, for the lower end, for the medial epicondyle it is 5th year, medial flange it is 10th year, for the lateral flange and capitulum it is 2nd year, for the lateral epicondyle it's 12th year. You can see this pattern here. And then the medial epicondyle fuses with the shaft separately during 16th to 17th year. The remaining fuse with each other to form a compound epiphysis, and then they fuse with the shaft during 18th year. So 5, 10, 2, 12, 16, 17, 18. This is the lower end. So which end fuses last with the shaft? It is the upper end, because it fuses during 20th year. Therefore, upper end is the growing end of the humerus. Alright, so this is about the ossification of the humerus. Thank you.